We are thrilled to have our speaker with us in person today and not virtually. Marianne Bitler is an economist at UC Davis and hopefully well known to all of you because she's done some of the seminal and foundational work on the safety net as it relates to health and well-being, and we're thrilled to hear from her today about I don't know what because she's changed the topic. But it seems to have something to do about child-targeted programs, and every time I hear anything she presents, it's worth the time and interest. So it will be good. Thank you.
Thank you.
I'm assuming we're doing econ rules, so you can interrupt.
Yeah, interrupt whenever, please.
Interrupt whenever, and I'll let you take it from there.
Okay, and I apologize for the switch. We're in disclosure timing, so with luck, my colleague who's supposed to give a talk next week will have the talk, but I don't have it yet. So hopefully it still has a theme of food assistance programs, and for those of you who are at the summer workshop, I apologize because you've already seen this. But there's a little bit at the end that's new for that too, okay? So this is joint work with Janet Curry, Hillary Hoynes, Krista Ruffini, Lisa Skulkin, and Barton Willage. So it's a pretty big group, and we've been working on this for a long time.
I think we might need you to be mic'd.
Okay.
I apologize. I know it's there on the table, but you're going to walk. Jeff agrees. So.
Okay. Sorry, usually projecting is not my problem, but
Masks and everything.
yeah.
I know we have you double mic, so it's not.
Let's hope it doesn't start with the feedback. Okay. So we've been working on this for quite some time, and I want to thank our WJ Evidence for Action for financial support and not blame them for anything I say. Okay? So I'm going to start off by trying to convince you that WIC is an important nutrition assistance program. So it's not huge in dollar terms, but it's very large in its reach. About half of births are to women who received WIC while they were pregnant. And there is an extensive literature that shows WIC leads to better birth outcomes, although Ted Joyce might beg to differ. But most of the research, including some causal designs as well as sort of more observational studies, shows this. And this program provides nutritional assistance. It used to be in the form of paper vouchers. Now it's in the form of EBT cards, or it's called EWIC, to pregnant and nursing women and to children until they turn 5. And while we know a lot about the infants, we don't know very much about the effects of this program on the children. So that's the thing that we're bringing to the table, is that we can say something about the children. So 3/4 of WIC recipients are children under 5, and we know a lot less about how they are affected. And we also don't know very much about other people in their households. So one concern of people who are skeptical about the WIC program is that once you get past the infant formula phase, the children are not getting the food that it's going to the adult males in the household. So we're going to bring a causal design that we think is well suited to this, RD, where the running variable is your age, because you age out of the program once you turn 5. In practice, what that actually means is that in most places you get a full benefit for a full month during the month you turn 5, and then you don't get it anymore, okay? And we're going to look at impacts on nutrition and health. And I'm going to give you a preview of the findings. We can look at a lot of things. We can show, using administrative data, a strong 15 percentage point decline in participation at age 5. In using the SIP, we can sort of make sure that it's not like all these people are suddenly then getting on other safety net programs at the same age. And then we're going to look at a combination of self-reported dietary intake. That is, so people say what they ate, and then people at NCHS then convert it into nutrients. Food insecurity and the healthy eating index, and a few objective health measures. When we started this project, we were hopeful that we'd be able to look at a lot of objective health measures, but because we need to look at kids right when they turn 5, and because the NHANES asked different questions in different survey rounds, that just didn't work out as well as we'd hoped. So we find little or no impact on the children's own consumption or nutrition, but we find evidence of spillovers, negative spillovers for women living with children who age out. They have heightened moderate food insecurity and reduced caloric intake. Yes?
I'm assuming like a lot of these kids are in kindergarten and might be receiving food at school as well. Are you able to sort of identify when that's the case, or like if it's,
Yes, so the key thing is this is when the kids actually turn 5. So yes, some kids are in school and some kids are out of school, but not very many kids turn 5 right when they start school. And so to the extent that that's a problem, we have, not in the results that are disclosed here, but we have a robustness sample where we get rid of the months during which the school year starts and ends. And in fact, the second paper that I'm going to touch on at the end looks exactly at school start and ending and food insecurity for kids. This is not a big problem for our causal design because most kids are not making that transition to school at the same time that they are making it otherwise. And the results are, if anything, a little bit stronger, a little bit. Well, I shouldn't probably speculate. The results are consistent when we make this restriction to getting rid of the months during which the school year starts and ends. Okay, so what does WIC do? As I said, it serves low-income, nutritionally at-risk infants, children under 5, and a variety of women. In fiscal year 2017, touched 7.3 million people, spent $6 billion. So that's about $41 per person per month, and about 10% of 4-year-olds are on the program, and it's one of few programs where everybody is eligible, including unauthorized immigrants, with the exception of the state can choose to opt out of this, and Indiana chose to opt out of this. But otherwise, unauthorized immigrants are eligible for this program, and in fact, in California, a lot of the participation is very Hispanic, and they think it's a lot of unauthorized folks. Okay. It provides vouchers for specific food items that are high in important nutrients. And it's a fixed bundle. So everybody who is eligible for the program gets the whole bundle, unlike a lot of other programs where the amount you get goes down as your income goes up. So you either get this program or you don't. And then you can redeem these vouchers at participating retailers. And because it provides for specific food items and not like a fixed amount of money, these people get the food items at the stores. They don't have to, there's no incentive for them to shop, so that causes some complications for the government in trying to minimize the cost of this. Okay, so what is in this WIC package? This is the WIC package for ages 1 to 4. So you see juice, single strength, particular amount. That means no added sugar for the juice. It has to be whole fruit juice. Milk, there are some restrictions on what kind of milk that have to do with they don't want kids drinking fatty milk anymore. Breakfast cereals, there's restrictions on how much sugar can be in them. Eggs, fruit and vegetables, there's the exception that they get this $8 cash voucher, which interestingly was made much larger during the summer as part of the COVID response. Whole wheat bread, and then legumes or peanut butter. So these things are all designed to target specific nutrients that women and children are low in. Okay? Yeah?
Sorry, how hard is it to sign up? Additional kid do it all at the same time?
You sign up each kid at a separate time or yourself when you're pregnant. So you go in and, I'm sure that so perhaps not surprisingly to some people in the room, USDA doesn't have a great sense of what every agency or state is doing for all of their policies. Periodically, they pay somebody to go survey the states about what their policy options are. Which doesn't seem to be the right way to track policy to me, but I'm not in charge of that. So I'm sure there are places where they try to coordinate things, but it's in principle, in some states, it could be that you have to go in and sign up your kids at different times, and then their time of ending might have something to do with their birthday or when they first signed up. So you might have to go back numerous times if you have numerous kids.
I was thinking that the 10% of 4-year-olds then is maybe an effect of this annoying.
Yes, although it definitely declines across time. So, like at pregnancy, lots of people experience an income shock. So many more people are eligible around the time of pregnancy because of lower income. And then, you see these subsequent drops at various, in a graph soon you'll sort of see it. But there's a lot of fall off at age 1. That's in part because the formula is a very valuable part of the package.
So I know that obviously households can do whatever they want with this stuff once they get them, but what is kind of the stated intention of the program? Is it supposed to be for the kid, or is it kid and mother while
No, the woman and the kid get different benefits. So the woman's supposed to eat the woman benefits and the kid's supposed to eat the kid benefits. And then, but obviously once the kid's benefits aren't formula anymore, it's very fungible for other people in the household.
Okay, so this is for only kids.
This is the kids package for ages 1 to 4.
And why is it 1 to 4, not?
Oh,
Is it through age 4? Or?
it ends once you turn 5.
Okay, so it's
I'm not showing the infant one because the biggest part of the infant one is infant formula, although I think after 6 months there's some things in there like infant meats, which are traditionally lowly redeemed because they're gross. But formula is a very valuable part, and more valuable than this $41 a month, because there's also behind this states get paid rebates by the formula manufacturers because WIC takes up a lot of real estate and stores. And so if they can get the WIC contract, they can drive a lot of people to their program. Okay. So these are all papers about children's use of WIC that are looking at a similar kind of RD design. This first paper uses the CLSB. The C. and Leonard uses data from one food pantry. David Frisvold and Leslie and Joe Price use home scan data. And then this paper is the closest to ours, but they're using the public NHANES, and they're not really, so we think our paper is better because it's more comprehensive and that we look at a variety of other outcomes, including administrative data for the first stage. But also because we can link kids to their moms, we can look, and kids to the other people in their households, we can look at spillovers, which they can't. And all of these other papers, the RD is something like months or years of age, whereas we can look at day because we have the birth dates in the RDC. Okay, so I think I already said everything on this slide, but we're looking at more nutrition outcomes. We have some objective health measures which are useful. We're the first to look at the spillovers, and then we use the NHANES. And I learned a lot about the NHANES, which makes me think it is not well suited to certain things I thought it was suited for before. So what is our empirical design? It's a fuzzy RD, so most states and benefits at the end of the month the child turns 5, and we're using that as our threshold, okay? So the assumptions are the standard ones that you're used to for an RD design, and I'm going to show you some evidence about this. So this is our specification here. So the key coefficient is beta 2. Age is the age of the child in days, away from this cutoff at the end of the month they turned 5 in the NHANES, or it's months in the SIP, and then we're doing standard RD things. So we have a triangular kernel. We're using the relevant NHANES survey weights. The function of age has a different, it's allowed to be separate on either side of the discontinuity, and it's a cubic in age in days. And we're right now clustering the standard errors, and we're starting off with a bandwidth of 719 days because, you can't go past 0 for the kids on the one side, but we thought that was like a reasonable trade-off. And we've also done some stuff that's not disclosed yet with the optimal bandwidth choice from Catania, Colonico et al. Okay, so how are you supposed to think about these effects happening? Well, first of all, when you lose the package, there's a loss of resources. We expect some reduction in consumption of WIC goods. Maybe it's a little more ambiguous about what happens with the non-WIC goods. And we expect this to mostly affect the kids or the people who are most likely to provide a buffer for them. So when we started this, we planned to look at the other children and the males in the household. And the other children we don't find very much for, although I don't think that those results are in here. And for the males in the household, there's some things about the way the samples is drawn that doesn't make them a great thing to look at. So just think of the, NHANES wants to be able to do good estimates for young kids. So when there are more young kids in the household, they interview fewer other people. And so that complicates looking at outcomes for some of the other groups. Okay, so the first thing I have to show you is there actually a change in WIC participation at age 5? And we're going to do this using the WIC participant and program characteristics data. And this is a census of data of people on the WIC program in April of even years. So every state, every WIC agency has to send this a minimum data set to somebody who compiles it for USDA's use. Okay? We can also look at this participation in other programs, and we're going to do a test of bunching at the threshold. And here, maybe if people have thoughts on what to do about this right now when we're doing the testing of the bunching, the designs, the typical tests don't account for weights in the data when they're sort of looking at how many observations are on each side. And so if anybody has thoughts about how to address that, it'd be great to know. Okay?
But the threshold is turning 5.
Yes.
So what would it mean to have bunching at the threshold?
It would mean that there's something weird about the sample of people in NHANES or the dates that are reported for their birthdays.
I see.
Like there's
It's
no.
not the kids who just never get beyond 5.
No, no. No, it's more this concern that there's definitely weird stuff about how they do the sampling, and just to make sure it's not causing problems with
If there's something.
something, yeah.
Okay.
So one more instrumental question. So the child loses benefits at 5. Could the woman still be getting benefits, or did she lose it already?
She lost it already at age, when the child turns 1, then that's the longest the fully breastfeeding woman could have stayed on the program.
Okay, so none of these women are actually losing any benefits.
No, we originally wanted to look at the age 1 RD, but you'll see in a minute why we don't. And basically, there's a lot of churning around it, so there's not so people leave and then come back on, so it's less clean because they don't completely have to lose access to the program. Okay.
Oh, like come back on for another kid.
Well, at age 1, a lot of people leave the program at age 1 because there's this loss of the formula, which is the most. It's worth like $100 a month to the families, but there are some people who leave, but they can come back on if they're still income eligible, and so there isn't like just a clean fall off for them the way there is when the program ends.
Oh, I see. Okay.
Does that make sense?
Yeah, so like the child leaves, and not only the woman leaves, but they choose for the child.
Yes. Yeah. Often the child leaves at age 1. Okay. So this administrative data that I mentioned, I already said this, I think. We don't have the full data. We would love to have the full data, but they won't give it to us. So we have a self-weighting subset of around 60,000 people a year. And we can calculate age in months from the date of birth and the fact that the census is done in April. And then we went to the vital statistics data to get a count of births for the particular birth months and years. Okay? And so this is showing you the WIC participation rate by age. So you can see here, that's age 1, and then you can see it's reasonably smooth, and then this is not perfect here, so that means there's probably some mismatch with not every place is doing it exactly on April 1st. Okay, so hopefully you can see, and you are convinced by the fact that there is a pretty big drop in participation right at age 5. Okay, and it would be bigger if we could do this in a way that accounted for people's like a more at-risk sample, or people that are likely eligible, like those under 185% of poverty, but we can't get those numbers from a great source for this for every month and year pooled across this time period. So just think you should inflate this up to understand the effects amongst the eligible, okay? So this is from the SIP, and it shows participation in a host of other safety net programs is not changing at age 5. And this one is limited to families at less than 200% of the federal poverty limit. And also, I should have already said this, but with 1 child between ages 3 and 7, because when we started this, we proposed to do it where there was only 1 kid, so it would be clear that the effect should be strong for them. Yes?
Do you have data on the kind of intensive margin of participation, like whether they buy the eggs?
We do not in this source. Getting the redemptions data is harder. And I don't think USDA has, so USDA has a data set about spending by which package it is, but you can't tell the age of the people on it. And states are, not surprisingly, a little reluctant. So far, the states we've talked to have been a little reluctant to share data with us about exactly what people were buying as they aged out. So one state gave us really cool data that showed the pattern of redemptions across the month, but then they just completely declined to attach any PII to it.
But do you have a sense of that over the course of the child's age, they're buying the whole thing?
Oh no, they definitely don't redeem the whole thing. No, sorry, I should.
Kind of decrease more? Is that smoother towards 0 at age 5?
That, I don't think I can answer that. So the data that I can tell you about for that, I mean, individual states that have EBT could easily answer this question if they wanted to, but they tend to, at least the states I know, tend to have limited capacity for things like this, and also are very big fans of the program, and don't really like to think about anything the program isn't doing well. But I can certainly say, at least for I was on a National Academy panel about the new WIC package, and so we got access to some data on redemptions, and clearly some things are more popular than others. So infant meats, very low redemption rate.
So participation just means that they get the EBT card and you don't know whether they use it or not.
They used it some, because they don't count you as a participant if you never used any part of it. It's possible that maybe you picked it up and didn't use it, but I think it's that you picked it up and spent some of it. But in terms of redemption, I don't think I mean, aside from the fact that it's only infants who are getting the formula, I think so the formula is super highly redeemed, and then the cash value voucher is very highly redeemed, and then some of the other things not so much. Wheat cereal, pretty good. Like I said, infant meat's bad. And actually legumes and peanut butter, not so great. And I think the whole grain stuff is not super popular either. So yeah, for California, there's a grad student in the Ag Econ department at Davis who's using the administrative data from California, and I think there she can sort of look at something like what you spent relative to what some price back of the envelope thing would be for the, but she hasn't looked at it by age. I mean, I would think if anything that they're more likely to use it up at the end, because I'm sure this data is a very salient thing to families because they've been told that, you know, they're gonna, it's not like it's a mystery that the benefits are going away. I just want to write this down in case there's some other data set we could check it in. Okay.
Can I ask sort of a general question on how to think about this? So if I wrote down the simplest vanilla economic model of lifetime savings, there should be no effect, right? That we're giving people stuff. It's completely known at age 5. This isn't go away. If people could borrow and lend, nothing should happen. So I'm not arguing that that's the right model, but what failure of that model are we looking for? So you could think about habit persistence things. So the fact that we subsidized this before might lead it to continue, or we can think we know people don't perfectly borrow and lend here, so maybe that's what's going on top.
I mean, I think we've seen. Sorry, did you have other?
Well, it feels like a very different kind of experiment than, say, taking somebody who's not on it at all and suddenly giving them the basket. Feels like a very different experiment than taking somebody who's had it for a while, knows that it's going to end at some point, and taking it away. So that's the question: is what?
I mean, I think that, you know, we didn't come in with priors that we were going to find really big effects. I think I'm not surprised that there aren't very big effects for the kids themselves. But, you know, if anyone were going to respond, I think you would think it was the mother. And I mean, I guess we could do more to look at the economic conditions of the families who, the problem is we don't have, well, we could look at the sort of components of what went into certification the last time they certify. I mean, we don't have very many people who turn 5 right around the April time, you know, but we could look at people who are 5, say, and sort of see if they're relatively more disadvantaged, and that would sort of address this like credit constraint thing. But, you know, it's clear that, you know, when you, or at least I've read papers where they interview the people using the program, and it's like more milk than they want. And it's particularly the paper version, because now I think you can split up what you get, so you don't have to buy a whole bunch of things at once, but then you had to sort of buy things in discrete, like parts of the package were on one check, and you had to buy all of it. And so it was inconvenient sometimes, like if you didn't have a car or something, and you have to buy a bunch of heavy milk and, you know, heavy like infant formula and stuff. But we could definitely try to address this by looking, I mean, it's going to be the stuff that feeds into the eligibility formula. So a large share of people are eligible because they participate in other programs, and they think that the states don't do a good job of getting their income. But I could say, like, you know, for people for whom there's income data and they're not eligible because of Medicaid or SNAP, here is something about how much income they have. I mean, I guess I would also say there's this phenomenon that I will try to convince you we can document, that when you lose access to school meals, you eat differently and your food insecurity goes up, which is also consistent with some of the similar aged people being in credit constrained settings. Okay, so I think that was about a previous slide, but back to this slide. Nothing is going on with any of these programs. Okay? You know, given caveats about whatever you think about self-reported data versus administrative data. So here's a couple graphs for you. You can see own Medicaid, SNAP at the household level are changing. So now I'm going to switch to talking about the NHANES. So we're using a combination of the NHANES 3 and the continuous waves that have been done since 1999. And these data are what the CDC or NCHS does to get a snapshot of health in the US. They oversample certain groups because they want to be able to make comparisons amongst rare groups. And so blacks and Hispanics are oversampled, and they don't do it in the way you would normally think of. They sort of try to pick locations where there are more people of that particular type. They go into the household, they enumerate who's in the household, and then automatically it tells them who they should interview, okay? And so the way this works is there's a van that drives around from place, or several vans that drive around from place to place. They go to about 30 counties a year, I think. And then they have the people who are chosen come in. There's an interview which asks stuff like date of birth and date of survey and social economic status and some program participation numbers. There's a food diary that's 2 days for most of our data, although it's 1 day at the beginning. And then there's a medical exam where they do all kinds of different things. So you have these objective health measures as opposed to sort of self-reported health measures and the various surveys where we worry some people don't know they have conditions, okay? And we also have the household roster. So normally when you use the public use NHANES, you have kids. There are people in their households who were interviewed, but there's no way for you to tell who they were. So you could not do this thing of looking at the same people who are in the household with a kid who aged out, okay, in the public use data.
Sorry, this is specific to the data, but how do you deal with like lack of recall for 2 days if you have people who are just have the second, or just have the first day but no second? Are you averaging the two?
We're just averaging. I'm sure that's not ideal, so maybe you can tell me later what we should be doing. And so the roster has everybody's birth dates, and then we also know whether they're survey respondents. And we use this to create spillover samples. What I'm going to show you today is a spillover sample of any adult females in the household. And then, as I said, we've done any adult males and other kids. And you know, we have a renewed application right now, a renewal application, because this was such a slow project that we managed to use up our 3 years and not have the paper under review yet, to use a sample that's more like moms, so women who look like they're more close to childbearing age, okay? So our child sample is going to be that you're the only kid aged 3 to slightly less than 7 in your household, and your household has income under 200% of the poverty level. NHANES income measures are not perfect, so if we used 185, we would see some people who say they're on WIC above that, okay? For our female spillover sample, it's adult women in a household where only one child has that age. And yeah, so we've run stuff for these other groups, but I'm not going to tell you. We're weighting using the weights that they provide, and I said this thing already about the averages for the dietary recall. So we need to do balance tests, especially given what I told you about the part that we can figure out about how they're choosing their sample. And so I'm going to show you some specifications where the left-hand side variable is these different outcomes, and then the right-hand side is the same RD design that we're doing otherwise. So these coefficients, as Jeff pointed out the last time you saw this, I think, are not as small as you might like. This is a noisy data set, but they don't all go in the direction of the being on one side being more disadvantaged relative to the other side, okay? So if you look here, you're slightly less likely to have less than a high school degree if you're over 5, but you're a little more likely to be Mexican, which is our measure of Hispanic. That's what we asked for in the data. And you're slightly less likely to be white. So, you know, the other thing that we haven't done for here, but we've asked to do, is to predict food insecurity with X's and then look at predicted food insecurity across this thing, okay? Oh, and I should say, we also ran a standard McCrary test, and well, actually we ran RD Robust, which is the newest Colonico, Cattaneo and Company thing that's sort of seeing if the number of observations on each side of the cut looks balanced in bins as you go to the side. This is the bit where we're not weighting it with the weights. Because if you weight it with the weights, it thinks there's a lot of observations there, and then, you know, small differences could become inflated, so we're not sure what to do. Okay. This is the same thing for the adult females, not quite as good a balance. The RD Robust rejects at the 5% level, but not at the 1% level. We are hoping that when we get to this more like the moms of these kids sample, this will look better.
I guess I'm kind of like a very small methodological question. So, I mean, I guess a few different things. Like, I think that Cattaneo et al., they can also, you mentioned bandwidth, I think they can also pick the polynomial. are you typically using a third order, and is third order, I thought I'd seen that there's some papers saying that can be a little bit unstable.
I think you're thinking of the Gelman and Inbin's paper about being driven by things on the ends. So we have also, like the data definitely don't look linear, I'll just say that. This bandwidth is pretty big. When we try to expand things and let their approach pick the bandwidth, it's picking something that's not, it's a little smaller than this, but not that much smaller. And obviously if you did that for every outcome, then we would have a different sample for every outcome, and then we would never be able to get anything disclosed. But I think the concern about the polynomials that's been raised is more like when you're using like the whole range forever. This is all just kids 3 to 7. And I'm sure that we've also run some stuff with different bandwidths.
And my other method question was about, using like an HRDD to adjust for here to separate cohort effect from age effect. I don't know if that could help deal with any of the lack of balance.
I think that all we've done on that front is to separate out the NHANES 3 from the continuous NHANES. And I don't remember anything about how different they looked. But, for sure, I guess what we...
It says like, 15 years of data, so adjusting for here, I don't know.
No, I mean, there's also another, there's always a new Catania paper because he writes a lot of papers. But there is a paper that suggests that it's preferred to not have a lot of covariates, but then there's a more recent paper that suggests something about the covariates, and I think we just haven't really settled on what to do. We do plan to do some robustness. We're going to pick our favorite outcome and do robustness to many of these different choices on that front. Okay, so here are the results for kids. Food insecurity isn't moving for the kids. The healthy eating index, if anything, looks better, which is not what you would expect. This is not a quantity measure. This is the quality per 1,000 calories you consume. And then along these other things, we're showing you one thing from the WIC package, which was something we think people, we didn't pick infant meats, but it's also easy to identify the WIC milk. Cotinine is one biomeasure, and so is hemoglobin, and then not enough food is also a measure we can look at. So you can see from this broadly, nothing is happening for the kids. So, if we also found nothing for the moms and anybody else in the household, then maybe we would conclude that, Chris is right, or else this isn't enough money to matter, okay? So then, here are the graphs.
I wasn't be right.
Yeah. Sorry, Chris bringing up the neoclassical model suggesting that I should consider that more seriously in discussing this is right. That's what I should have said. And then here are the graphs, and you can see it also looks like, things are fairly smooth. This gives you some sense of how noisy the data are as well, okay? Sorry, I have my phone on so that I would know the time, and then let me just turn the sound off. Sorry about that. So here are the results for the adult females, and it seems like there's more going on here. It's not disclosed, actually, so I should say it's not disclosed because this was our first time doing things in the RDC, and we didn't necessarily know what we were doing as well as we know now. And we thought that we were going to have the same sample of moms and kids in the same units, so we asked to disclose adult food insecurity for the adults and child food insecurity for the children. So what I can say is there's an effect on adult moderate food insecurity for this sample, because every unit, they ask some questions that are about adult food insecurity, they ask some questions that are related to child food insecurity. So for the adults, not necessarily women, but the adults in the households with these kids, there's more moderate adult food insecurity, okay? But we have to wait for the disclosure to end before I can show you that, okay? So now I'm going to show you for this different sample, which has some kids who are aging out where the kid wasn't interviewed as well, because it turned out, we didn't know this beforehand, but it's often not the same women who are interviewed as the kids. And even sometimes there's women interviewed when there aren't kids interviewed, okay? So you can see not quite statistically significant, but fairly substantial increase in adult moderate food insecurity, a pretty big decline in calories, and then not so much on these other measures, except for maybe this increase in not enough food, okay? So then you might be looking at that number, and yes, Jeff? Yes, that's what I was about to say. So this 700 calories is big, right? Here's the graph. The graph is consistent with a big number. And you can sort of see, even for this sample, this suggestion that there is this increase, albeit not statistically significant, in moderate food insecurity. And then not so much going on the other things, okay? So something important for the graduate students in the room, like, you don't want to get a 0 unless it's really precise and surprising, but you also don't want to get a huge number you can't explain because people don't believe it. What can I say about whether that's too big? Well, certainly the change in moderate food insecurity is similar to what some of the experiments where they've provided EBT summer feeding programs are. I'm not going to say that the calorie numbers fit in with that, but the food insecurity change is consistent with that. And I guess, it would be, if we could get some, coming back to the question about the redemptions, if we could get some redemption data, I think it would support this, perhaps being right if you could sort of see that maybe they didn't spend everything, but then when it's going away, they make sure to spend it all at the end. Now, why that would translate right into eating, who knows, but.
So just to make sure I understand the interpretation here, like people seem to be consuming a lot more calories 1 year between when their kids are 4 to 5. Like you see this ramp up as the year preceding the drop off. I guess it's quite different from if we just saw kind of it looks flat and then it drops off.
Fair point.
Turns 5, right? It seems like a different story.
I mean, this graph does look similar if you exclude the months that are the school start and end months. I suppose we could also try to see if there's other evidence about how people's, food is changing, because it does look upward. I mean, I should also say, like, if we had more data, I would prefer if we had a smaller band, I would like for the data to have chosen a smaller bandwidth, but it's kind of noisy. So this is across a wider range than many RD studies would show you, but that's just what we have to work with.
Can you use like prior month's milk allocation? Like, can you build up your milk stock? Each month you are able to get a gallon of milk, say. If you don't get it last month, can you get it in the next month?
No, it expires at the end of the month.
Oh, okay.
It's not like SNAP.
It's not like they're using it all up right at the end before everything expires.
No, I think it's more that they're redeeming the full package at the end. And, whatever change that meant for what was in the household, the mom is buffering what is happening for the other people in the household is our preferred interpretation.
Can you just talk a little bit more about how the calorie measure is, how do you end up with calories? So it's recall of food?
It's recall of food, and then they translate the food into micronutrients and macronutrients, thus calories. And, how good is it? This is what we have, right? There aren't other good sources of even food acquisition. Food apps cost like $10 million to collect a week's worth of food acquisition. It's not even consumption. Obviously, this would be an easier sell if we were seeing big things in the biomarkers, and we did try to focus on biomarkers that would move quickly.
I guess I'm trying to, like, 700 calories, like, is it around a birthday they're eating birthday cake? And, literally, I'm trying to figure out, like, what
Certainly.
parties or, like, I'm trying to figure out, right?
So the big uptick there is like 120 days before, so it's not like right around the week. Things that, I'm sure you're sympathetic to the disclosure challenges. We could explore some things with some donuts to sort of avoid the exact timing of the birthday. So that's something that we probably haven't asked to do, but we could, it can go on the list for things referees want to see. It's also the end of the month that the kid turned 5, so it's not like, that's not every state is that it's a whole 30 days. In some states, it's like something between, 0, it should be uniformly distributed between 1 and 30. But
I don't know if you have data on the like kids like attendance using like Head Start or pre-K or school or whatever, but if you did, it would be really curious to see if there's like any, I don't know, like they would, I can remember you said about how frequently they do these measures, but if you have these measures for like around that period of time, it would be interesting to see if like you do notice like a discontinuity in calories, like when like the child begins, attending somewhere that could be providing food, so that it could be like a shift in consumption in the family.
So I know it's not, I'm sure there's many people in the room who know more about Head Starts and pre-Ks than me, but I'll go forward anyway. That said, I for sure there's a number of Head Starts that are not full year, and so they often track the school, at least the ones we've been able to look up kind of track the school year, and I'm pretty sure that the New York pre-K is the same way. It tracks the school academic year for New York State. And so the robustness check that sort of took those months out where schools start and end should also address this concern, I think.
It's not as much a concern as I'm just trying to think, like, to explain your results, like if you could find evidence that like a couple of years before when the students started school, that was a period when the family was able to switch consumption of like the vouchers from like feeding the child to like feeding the mom, because now the child is getting food at school. So
I see. So I
see an increase in the core, that was sort of maybe similar to the decline you're seeing. That would sort of be additional evidence that what you're seeing is a substitution across families from like the child to the mom, or within the family from the child to the mom, and like who's consuming the.
Yeah, I guess we could try to, I don't think we have a measure of current school attendance. I think we have some usual school measure. I've been interpreting this as like there's less food and the mom is the person that takes the hit, and I don't think it's the kid is not taking the hit. So if the mom was already eating it all, then the mom is the person who's reducing their consumption. And if the mom wasn't eating it all, then somebody else's consumption is getting substituted and she's eating less. And I know I keep saying mom, but really it's adult females.
If you look at the distribution of the calories, and is that drop somewhat uniform across the distribution? If you see like people go from like 3,000 to 2,300, or is it crossing the threshold of that sufficient nutrition?
Much as I love distributions, I'm not sure these data would be a good candidate for doing an RD distributional design. And remember, these are cross sections, so we don't have the same, I think if we had panel data, then we could sort of say this person used to consume 3,000 calories, what is their decline versus, this person didn't, but it's not panel data, it's like a single snapshot, so.
So do you have any data on like what are actually, I know that they did the food diaries, do you only get the calories or do you get like what they're eating? Because I guess one thing that's like particularly shocking about the huge drop in calories to me is that you would think if you're substituting away from these healthy foods to maybe like cheaper foods, they could actually be higher in calories. I'm just wondering if you have any way to get at that with the data from like food diaries.
You don't have all the raw inputs, but you have categories. That's how we created this WIC milk package and other milk. We can look at soda. We don't see a lot for soda. We don't see very much across the individual components. I guess we could try to look at less healthful things. But I think there are probably two things going on. Like whoever's eating this food, it's probably more, we know there was a huge pushback when they shifted to whole milk. So at some point they started saying you have to have whole milk, you can't have whole milk anymore because it's not helpful for kids who are over 2, when they changed the dietary guidelines. And there was huge pushback on that. And so I think to some extent this is constraining people to buy stuff they might not necessarily buy otherwise. So that's going on at the same time as, total food coming into the household from this source is going away. I mean, I guess something we could do is try to figure out, like, I think maybe we could get this from one of the panel reports. What does this $41 actually buy in terms of calories? But again, if it's substitution for different, like stuff the mom was eating is going away, that's not going to necessarily be informative. Okay.
I had a question about, do you know when notices go out telling people their benefits are about to expire? 'Cause I wonder if that could help explain.
They don't get notices. What they would have gotten in this time period is that they got 3 months of issuance, and if the kids was going to run out in that time, maybe they get 2 months or 1 month. And they tell them no more kid benefits are coming.
So they realize in the 3 months or so.
I think it's probably random as to which, if everybody was on schedule, I think you would get a full 3-month thing that would end, right, when you turn 5. But I think there's a lot of, as you saw in that graph, there's some churning, and so not everybody is certified for a 3-month period starting at birth. But some people are actually coming onto the program later. Okay, other questions? Okay, so I'm racing through this, but nobody's ever sad to get time back, I know. So let me conclude what we've done so far with this. So using a fuzzy RD, we've explored the effect of children aging out of eligibility for WIC at age 5. We found no evidence that children are consuming less. We found evidence that we think is consistent with mothers providing a buffer. We would love to do more to decompose how that's working, but we can't really do that with these data. There's some hope that they've done a big study on children who were participating in WIC and what they called the FIT study, and they're going to follow the kids to age 6. So we're hopeful that we can follow up on some of this work and at least document the no changes for kids in this work. Jeff?
I'm a little puzzled by the interpretation, I guess, in the last bullet, but looking at that graph, what it seems to me is that, yes, it's true, the mothers or the adult women in the household, food consumption goes down at the 5th birthday, but it goes down to where it was the year before, right? And so that seems to me to have a bit of a different sense to it than the way you have presented it here. And to me, the puzzle is why did it ramp up, right? It goes back to where it was. And maybe I want to worry about the optimal bandwidth isn't very optimal here, or maybe I want to think there's some behavioral thing going on, like they're sort of realizing the end is near and they're consuming more of the bundle they're eligible for. But in either case, they could have consumed more a year ago and they didn't. And so so I feel like it's been spun a little bit like they're really worse off, but they're just back where they were a year before and they chose to be there.
Yeah, I think I would just interpret this more as like, whatever change happened, the women are buffering it, is I think the way I would, I agree that, some people think that, well, I'm not even going to.
No, I agree with that there's stuff going on in the household that we should worry about that.
I think that is a better way to characterize what I think we can say with these data. And it would be great if we could do more to sort of understand how are the changes happening. Like the dream data set would be EBT data from a big state where they would let us do whatever we wanted. And well, that's always the dream, right? But where you could sort of see about the redemptions piece, and maybe it was linked to SNAP data, and you could see like something like because you can only ever actually see everything people are consuming if you survey them and then link it to this administrative data. And I just don't think that's in the cards for us. In terms of the bandwidth piece, we can address that with, like there's every different sample seems to cause complications with disclosure, but we could certainly do the thing that's maybe you don't do the optimal bandwidth, but you just pick some other bandwidths that are closer to the point. And that would probably, we could do that as well.
You could switch to the GASCI kernel, which has support on the whole real line, so you're always assigning some positive weight to all the observations. And then if the census people don't realize that it's a sample trick, it's always the same sample.
Yeah, trying to explain to the RDC, the NCHS people, RD has been extremely challenging. But that's something we could try. Yes, I think this is one of the first times I faced this tension between doing it the way I think is the sort of quite the right way versus the way that I can get disclosed. And it's given me insight into some papers I've been a referee for.
I was wondering if you could talk a little bit about how we should think about selection into the program over time. So like moms who are finding or families who see less value in the program are less likely to use it over time to see this fall off. And so their food consumption could be different in those different subsets of families. So I'm not sure how to think about comparing people when kids are at different ages of participation, because they might have different underlying food preferences.
I'm sure that's true. I'm sure the people who stay on to the very end and are kicked off are somewhat different. I mean, that's part of why I think it would raise, there's questions about generalizability of these findings beyond this particular setting. I think a lot of what's happening is, you know, when you have a new baby and you're getting a very valuable voucher for formula, you're happy to go to WIC. You get people who are nice and friendly. There's work by, I can't think of her first name, but Barnes at Duke, who's done a lot about these folks. You know, it's a nice place. And then as your kid gets older, you come in. I've sat in on one of these interviews for my panel, and like, they're telling you your kid's overweight, they're hassling you, you know, like, so you're only gonna stay on if you really value the benefits, or I guess maybe if you sort of, you know, already had preferences that were aligned with this, which seems unlikely. But I guess we could do more to sort of look at the character. This fits in with what Chris was saying about looking at the characteristics of the people once they age out. It's just we don't know, mostly we know just the stuff that goes into the eligibility formula. I guess we could say, take people around this. Would you be more compelled if I could say something about what people who kind of look like the people who are still on WIC at age 5 eat? Would that be?
Yeah, I mean, in thinking about, are we seeing differences in calorie consumption across time because they're just different people?
But I mean, to the extent that, you know, I mean, certainly that's a concern, but that says more about, you know, the difference between here and here than it does about the difference between here and here, right? That's like a 240-day period, so that's 4 months.
But I think it speaks to Jeff's interpretation, right? Like, it's not clear we necessarily want to think about this as the same families across this whole country.
No, I definitely think that's true.
Can you go back maybe and talk about what the policy question was sort of in your mind looking at this? Is it about whether or not WIC benefits should end at age 5? Or?
I mean, I think that is a policy question that's of interest. There's always been this desire to have WIC go until kids start school, but administratively it seems infeasible to expect states to know when like, I guess you could do it to be like when kids are supposed to start school, you know, and there's also, we don't know as I said, we don't know a lot about kids on this program, and they're a reasonably large share of the people, if not the dollars. And so sort of documenting whether this program seems to do anything at all for these families, you know, is informative for thinking about whether 5 is the right place to cut it off. I think that's what sort of drove us, and the fact that we have a clean identification. What I think is a very, even I can say this because I've written papers that use less good identification schemes on WIC, to use a paper that has a cleaner identification scheme. Okay, so you can keep asking questions if you want. No, I'm going to switch slides, but you can keep asking the questions.
Going back to the caloric distribution thing, couldn't you do something that's like less than 1,500 calories, less than 2,000, over 2,500 or something like that?
Yeah, we could do that. That's a good idea.
It's not really as data intensive.
That we could do. That's a good idea. Okay, so here is a whirlwind, some short information about the complementary piece of this work, which is looking with the same large research team Actually, no funding from our WJF, but, well, I mean, they didn't like this part of it, so they only paid for the WIC part, but we're thanking them anyway. Because they wanted us to also do some other things that the NHANES isn't feasible for, okay? And this is going to look at when school starts and ends and effects on kids, okay? And so the motivation for this is that a lot of kids participate in the national school lunch and breakfast programs during the school year. These provide free meals to kids with income under 130% of poverty and reduced price meals for kids in a somewhat higher range. And increasingly over time, many schools have opted into feeding everybody at their school with school meals. California is now going to provide school meals for everyone. Probably some other state is doing that too, but I live in California, so that's salient to me. And the point is, there are a variety of summer feeding programs that have tried to step up during COVID, as probably everyone is aware, to feed kids who weren't in school anymore. But people don't like to go to pick up food when they don't have to. So if their kid has to be in school, then their kid is going to get the food. But participation in these summer feeding programs is much lower for a variety of reasons. It's a combination of, it's not like people are going to the school site or necessarily to whatever the congregate site is in the community where the food is available. It's hard to get your kids there. Your kids might be doing other stuff. So there is definitely this phenomena that lots of kids get food at school, and then the summer comes, and then many fewer of them are getting food from these sources, okay? So, that was the motivation for this part of the project. Kids might be losing 10 meals plus snacks a week, okay? So what are we going to do? Well, we're also going to use an RD design here. Here the methodological complication is for any kid that it's not the first time they go to school, there's a school end and a school start. So the window that's on the side of the summer can't go very far, at least because there's this other discontinuity happening. So the data aren't going to be as dense. I mean, we have more data because we have all the kids and not just kids turning 5, but it's not going to be, we can't have a very long bandwidth in the inside the summer part. This is where Barton's a bit of a data whisperer. It's always great to have a data whisperer on your team. So he was able to get a lot of states to share information on school start and end dates. And then we've assigned it to the largest school district in your county where we have it. So it's spottier going further back, both because, mostly because we didn't have data on the county where people lived, okay? And we also intended to look at spillovers here, but we're going to look at primary and secondary school separately, approximately like 1 to 6 or 7 to 12 or 1 to 5 and 6 to 12. Obviously, it's not going to be a perfect split, but the motivation for that is twofold. First of all, participation rates in school meals are higher, and kids have a lot more autonomy over what they eat when they're older, okay? And I think you could view this as an update to Janet's work with Jay Bhattacharya and Stephen Heider, where they looked at Heat or Eat using the same data, where they basically just compared kids in summer to kids the rest of the year, okay? So it's going to be the same outcomes as the WIC analysis. And then Krista's done a lot of work on school meals programs. So she has some data from some states where you can look at how many kids were getting meals during the school year. And you can compare that to some amounts, so it won't be a perfect RD, but we can, if you assume that nobody's getting the summer feeding, then you can do that. And we can also get some aggregate data from USDA on the school meals, on the summer feeding programs, which usually are quite small. They were massive last year, as everybody knows, okay? So I don't think I even need to say this. It's the same design as previously. Let's see. We looked at some of the similar balance things. Again, out of 20, 3 were significant at the 10% level, but the differences weren't all in the same direction. So even for this thing where we're pooling all these ages, these data are still pretty noisy. And the takeaway for the results, children in grades 1 through 6 mostly have worse outcomes after, so this is backwards. Outcomes are better once school starts, and they're worse once school ends for the kids, okay? So this is about being on the bad side of the discontinuity. So once the school year ends, the kids' consumption is lower. There's some suggestion of eating some more unhealthful things. And there's also an impact for these older kids where it can't be working through this free school meal channel entirely. It has to be partly working through some other kind of, no matter what kind of garbage you eat at high school. I have a high schooler who's in school for the first time this year, and he's eating lots of snacks on his way home. But whatever he can eat there, he would have been eating even more during the day at home all day during COVID anyway. The school end results are somewhat consistent in this early round of this with worse nutrition. Only milk is significant, so they're more statistically significant for the school start than the school end. And none of them are significant for the older kids, okay? And this is what we have left to do with this project. But I think this also, is interesting that, we have these two different programs that work in different ways, and in one of them we find this thing that clearly is happening to the kids, whereas with the other one, we sort of aren't finding anything.
So with that, is that maybe it's not a big deal in the data, but I worked for AmeriCorps and there was a summer camp program and kids were getting fed at that as well. And I would imagine with a lot of low income students, there's things like that in this country. But one period where that wouldn't be the case is over winter break. And so I'm just wondering if that is something that you sort of just look to see the results are similar when the schools are still being, the meals are being cut off because kids aren't in school, but there's probably not other confounders due to out of school supplemental programs and stuff.
I mean, if the other programs were really big, then we'd find nothing. So I think the fact that we're finding something suggests that the other programs aren't big enough to replace everything. But I think winter break is harder to find the time. I think we just felt like it's pretty short, so it wouldn't be great for our design. It doesn't mean we shouldn't maybe look at it, but that would mean that the right end of the window would be 2 weeks or something. And I definitely don't think we have enough data to do much there. Although again, a throw out for the methodologists in the room, is there some literature about when you have these settings where there's multiple discontinuities? And naively it might seem like you could just control for the other one, but I just wonder if anybody's heard about any papers about that. So I think these are complementary papers that sort of suggest real effects for some people of some of these programs. And I hope I've convinced you that they're at least consistent with the idea that, there are groups who are not able to fully plan for when food is going to become unavailable, even though it's a very predictable thing. Everybody knows when their kid turns 5. Everybody knows when every parent, I think, knows when the school year is going to end. And yet there are these responses. Any more questions?
Well, thank you.
Thanks for all the comments and questions.